In this video, I'm going to do a quick demonstration of the best use of the outpatient outcome tool. You can see in this test clinic I have two patients. Please note that you cannot outcome a patient unless the patient has been checked in. In these two examples, you can see they are in the confirmed state, which basically means they just have an appointment. If a patient did not attend and you want to DNA the patient, this is performed from the menu directly from here, selecting Do Not Attend. The check-in process will normally take place by the administrator within the clinic. However, if you are performing a virtual clinic, you will need to confirm the check-in process yourself. Once the patient is checked in, you will be able to see this in the bar. In this example, we would have completed our documentation, reaching the final component in the workflow, and you can perform now the outcome and check out. I will run through the outcome page. You will notice the first item on the right is the service. This comes from the appointment type and the treatment function that the patient is booked into. If for whatever reason your service is not available, you can change it from here. As you can see, there is an option for a generic outpatient clinic if your service is not present, and by clicking on the heart icon here, it will default to all your types of clinic. The next button down the line is when you're ready to check the patient out. In order to check the patient out from the clinic, you will need to at least select one of the options in the boxes here below. In this example, I shall restore to the gynecology service where the patient has been booked under, and I would have performed at least a consultation. However, I can select whatever other procedures I have performed. You also have the ability to change the time when the procedure has been performed. As you can see, it will default to the appointment time. However, you can change it here if the patient has attended either prior to their appointment or at a later stage. Now I have completed my coding. I will check the patient out by clicking on this button here. Please note that the options you have will depend on the initial referral to treatment target. In this case, this patient has attended their first appointment, and I will be awaiting investigations. So I would select the option number 20. You'll notice that this option will necessitate booking a follow-up appointment. And it reminds me here by a red warning banner. By clicking on this actionable text, it will take me to the new order entry page where I can request my follow-up. Once I've placed a request, I can simply go back and refresh this page, and you can see the system has picked up that I've requested a follow-up. I will then select the next option, which would be that I've requested for an appointment at a later date, and that completes the checkout process. Refreshing the screen will confirm that the patient has been checked out, as you can see. In this example, where the stroke medicine service have not configured a specific outpatient outcome page, you will see that there is the specialty service and the no config indicator. In this case, I will select any other specialties or the generic outpatient specialty. I will select clinician only or any other option that applies and check the patient out. In this case, I have no reason to see the patient again, and I will have the option to discharge from my care. That concludes the clinic outcome. The final function of the outcome tool is the ability to toggle the procedures to the primary. And as you can see, by clicking on this button here, I can switch the priority of the procedures in order to make my papal biopsy as the primary procedure. And then finally, I'll just click on Update.